The concept of Introduction to Ancient Greek Surgery, setting the context, serves as a foundational gateway to understanding the rich legacy and pioneering advancements the Greeks contributed to the field of surgery. Ancient Greek surgery marks a significant turning point in the history of medicine, where the amalgamation of empirical practices and philosophical inquiry laid the groundwork for modern surgical techniques. At its core, this introduction involves exploring the cultural, social, and intellectual landscape of ancient Greece, which fueled advancements in surgical knowledge and practice. The significance of this context lies in recognizing how ancient Greek surgeons, despite limited technology, made substantial strides through observation, dissection, and the application of logical reasoning. These early practitioners, such as Hippocrates and Galen, are lauded not only for their surgical interventions, but also for setting ethical standards and systematic approaches towards patient care, many principles of which endure today. The Hippocratic Oath, for instance, underscores the moral foundation of medical practice that has persisted through the centuries. One pertinent example is the development of surgical tools and techniques. Instruments like scalpels, forceps, and catheters were crafted to precise specifications and illustrate the Greeks' emphasis on innovation. Another example is the practice of trepanation, a procedure involving the drilling of a hole into the skull to treat conditions like epilepsy and head injuries. While many historians celebrate these contributions, some opinions argue that Greek surgery, while advanced for its time, was often rudimentary and fraught with limitations, such as a lack of anesthesia and a high risk of infection. Challenges to these advancements include the limited anatomical knowledge due to cultural taboos surrounding dissection, resulting in a reliance on animal anatomy as a proxy for human physiology. Contemporary critics might also point to the patriarchal nature of Greek society, which restricted the involvement of women in surgical practices. This introduction sets the stage for exploring the broader pioneering history of ancient Greek surgery, illuminating its influence on successive generations of medical advancements. By understanding the foundational context, we appreciate how the Greeks' integrative approach to theory and practice not only shaped their own era, but also left an indelible mark on the medical world, influencing its evolution through the ages. In delving into the foundations of surgical practices, early techniques, and innovations, one uncovers the rudimentary yet groundbreaking advancements that laid the groundwork for modern surgical methods. Ancient Greek surgery marked the inception of systematic medical procedures, characterized by a blend of empirical observations and inventive techniques. At its core, this concept refers to the initial development of surgical practices during ancient times, wherein Greek physicians began to experiment with and refine methods for treating injuries, ailments, and anatomical abnormalities. The significance of these early surgical practices to the broader topic of ancient Greek contributions to medicine is profound. As pioneers in the field, Greek surgeons not only devised practical techniques for addressing physical ailments, but also set a precedent for scientific inquiry and anatomical study. Their work embodied a shift from mystical explanations for diseases to more empirical, observation-based approaches, forming a crucial bridge. Key examples of these innovations include the work of Hippocrates, often referred to as the father of medicine, who developed a systematic approach. Another notable figure, Herophilus of Chalcedon, one of the earliest known anatomists, conducted dissections that greatly improved the understanding. Support for the impact of these early practices comes from historical and medical scholars who recognize the Greeks' emphasis on rational thought. The ethical implications of human dissection, for example, sparked controversy, and the limitations of the era's technology often made surgeries risky. Furthermore, alternative viewpoints from contemporary cultures sometimes offer differing medical philosophies, creating a rich, albeit complex. The influence of ancient Greek surgical practices extends beyond their immediate era, affecting various aspects of medical history. In summary, the early techniques and innovations of ancient Greek surgery represent a critical juncture in medical history, catalyzing a legacy. The heading Influential Figures in Greek Surgery, Pioneers and Their Contributions introduces the concept of pivotal individuals. The significance of these pioneers lies in their contributions to surgical methods, anatomical understanding, and the establishment of medical ethics that have impacted medical practices throughout history. One of the most notable figures was Hippocrates, often referred to as the father of medicine. He revolutionized medical practice by advocating for rational and systematic approaches, emphasizing the importance of patient observation and documentation. His teachings and texts, including the Kiki, Hippocratic Oath, continue to influence modern medicine, highlighting the transition from mystical and superstitious beliefs to empirically based practices. Another key figure was Herophilus of Chalcedon, who is credited as one of the first to systematically perform dissections on human cadavers. His contributions to understanding the human nervous system, particularly differentiating between sensory and motor nerves, were groundbreaking. The significance of these contributions is profound, as they form the cornerstone of medical sasa, practices that prioritize patient care and ethics. These innovations were real-world applications that guided surgical procedures and medical education, fostering a legacy that persisted throughout the Roman era and into modern times. Supporting opinions laud these pioneers for their forward-thinking approaches and the foundation they laid for evidence-based medicine. However, challenges and controversies also arise, particularly surrounding the ethical implications of dissections in ancient times, which were often performed on prisoners or purchased bodies. This raises questions about consent and the moral boundaries of early medical research. In connecting to other aspects of ancient Greek surgery, these influential figures provided a framework for future surgeons and anatomists. Their contributions were instrumental in advancing medical knowledge not only in Greece, but also in the broader Mediterranean and Near Eastern worlds, influencing various medical traditions. Ultimately, the pioneering efforts of these figures in surgery illustrate the rich tapestry of innovation and moral inquiry that characterizes the history of ancient Greek medicine. Through their legacy, one can trace the evolution of medical practices that continue to shape healthcare today, underscoring their enduring significance in the history of medicine. Advancements in medical knowledge during ancient Greece marked a significant transition from reliance on mythology to a foundation rooted in scientific inquiry and rational thought. This period was crucial as it represented a shift where empirical observation and logical reasoning began to replace supernatural explanations for health and disease. The Greeks started to see the body as a complex system that could be understood and treated through methodical study, laying the groundwork for modern medical science. This transition is significant within the broader topic of ancient Greek surgery, as it highlights the evolution of medical practices that made surgical interventions more sophisticated. By moving away from myth, Greek physicians could develop more effective and systematic approaches to surgery. This change resulted in healthcare practices that were more consistent, reproducible, and based on evidence rather than superstition. Two prominent examples illustrate this transition. First, Hippocrates, often referred to as the father of medicine, championed the idea that diseases were caused by natural factors and not divine intervention. His Hippocratic corpus laid the foundation for clinical observation and introduced concepts like the Hippocratic Oath, which still influences medical ethics today. Another example is Herophilus, an Alexandrian physician who conducted some of the earliest known human dissections. His studies in anatomy, notably of the brain and nervous system, provided insights that were far ahead of his time. Support for this transition can be found in the writings of intellectuals like Plato and Aristotle, who emphasized knowledge and understanding through reason and empirical evidence. However, this shift was not without its challenges. There was resistance from traditionalists who clung to religious explanations, and the dissection practices, in particular, faced ethical and moral opposition. Moreover, the empirical approach was limited by the technological capabilities of the time, restricting the scope of medical understanding. This advancement in medical knowledge not only transformed surgical practices, but also influenced other aspects of Greek society, such as philosophy and education. It set a precedent for viewing human inquiry as a pathway to truth, affecting disciplines beyond medicine. This transition from myth to science was pivotal in shaping a culture of knowledge that valued evidence and observation, principles that continue to underpin scientific endeavors in modern times.